Hello everyone, and welcome to a session on infection prevention best practice COVID-19. In the next few minutes, we will review the infection prevention and control recommendations for patients with suspected or confirmed coronavirus disease, or as we know it, COVID-19 in the healthcare settings. So who needs to wear PPEs? Patients with confirmed or possible COVID-19 infection should wear a face mask when being evaluated or having a medical checkup. We as healthcare personnel should adhere to standard and transmission-based precautions when caring for patients with COVID-19 infection. Now let us discuss the latest CDC recommendations with regards to infection prevention best practice. There are a number of recommendations, but we will just focus on a few. We need to minimize the chance for exposures to patients and visitors, as well as healthcare personnel. We can do this by ensuring that patients and visitors who come to the facility wear their own cloth face covering. And if they don't have one, we can offer them a face mask. And as healthcare personnel, and as part of source control efforts, we should wear a face mask at all times while we are in the healthcare facility. We also need to adhere to standard and transmission-based precautions. We can do this by ensuring that we perform proper hand hygiene, and we can comply with the 5 moments of hand hygiene as recommended by the World Health Organization. We also need to ensure that we wear the appropriate personal protective equipment. When we have patients that are either suspected or confirmed with COVID-19, we can place them in a single room with the door closed, in a designated unit within the facility, and if we have more than one patient or patients, we can cohort them in the same room. We need to exercise precautions when performing aerosol generating procedures, such as when suctioning patients. We should make sure we wear an N95 mask or a popper. We must also limit the number of unnecessary staff during the procedure, and this procedure should ideally take place in an airborne isolation room. Upon completion of the procedure room needs to be cleaned and disinfected promptly. There should be equipment that is dedicated to be used for COVID-19 patients, and when needed or upon completion of using the equipment, we need to ensure that the equipment as well as the surfaces undergo terminal cleaning. Thank you.